Good morning. I'm Susan DePasquale, and I'm a clinical nurse educator at St. James Healthcare in Butte, Montana, part of the Sisters of Charity of Leavenworth Health System. And I'm happy to invite you today to join a nursing presentation for our Nursing Preceptor Collaborative and Retreat. The objectives are listed in the course outline for nursings, and I'm also happy to introduce a personal friend and colleague, Dr. Joni Walton. Joni works in a variety of roles as an advanced practice nurse. She's been a nurse manager, staff nurse in the ICU, researcher, and educator. Her focus has been on spirituality, workplace culture, stress reduction in the workplace, and team building. She has numerous publications and has received the 2011 Academic Nurse of the Year Award from the University of Missouri in Kansas City, the Distinguished Scholar Award from Carroll College in Helena, Montana, and the 2012 ANNA Researcher Award. So today we invite all members of the nursing team to join in dialogue with Joni about some difficult issues that we face on a daily basis and how to address these holistically. So we're at Joni's home in beautiful Helena, Montana at Hauser Lake, and I'd like to invite Joni to talk to us.
Thank you, Susan. I appreciate it. Well, Susan told you a little bit about myself, but I want to tell you a little bit more. I do work as a staff nurse. I've worked off and on for the past 30 years, most recently in the intensive care unit. Also worked as an advanced practice nurse and a manager, and there are some issues that are burdening me as well as the nation, and I thought today we will start by talking about some of those issues and bringing them to the forefront with a variety of people, managers, staff nurses, supervisors, so we can talk about how we're going to improve our workplace and how to improve patient outcome also. You will have a packet that you've been provided that will have some articles in there, and I'll be talking about some research studies that I've done and how we can apply those to our current practice. I'm going to start out talking about stress. You know, acuity is really high right now. Our patients, the length of stay is shorter. Staffing is unpredictable, despite our best intentions. Oftentimes nurses don't even have lunch breaks or breaks to go to the bathroom. They don't have time to dialogue and network with their colleagues, even on issues that where they need to consult each other. Where in the past, under better staffing and less acuity, that there would be time to discuss within the team in-depth issues about patients. We don't have that anymore. So what's happening is in this fast pace, we tend to be more task-focused. We tend to not take care of ourselves. So stress. When you don't eat and when you don't sleep well, when you come home from work so burdened that you really look back and say, you know, maybe I could have done a little bit better. I forgot to do this, I forgot to do that, or maybe you didn't forget it, you wanted to do it, but you didn't have time because you were setting priorities. ANA has reported that nurses leave the workplace after a shift feeling hopeless, and that's just not what we want as professionals. We want to be proud of our work, and we want to feel like we've made a difference in people's lives. So where do we start? I want to tell you that we need to start with ourselves and taking care of ourselves, because as a profession we tend to do everything for everybody else and we leave ourselves last. The research shows that nurses will do everything for everybody else, and right now, in order to change for nurses, the research is showing that you have to use a buddy system, because a nurse will change for somebody else, but not necessarily for themselves. So I'm going to bring up the ANA Code of Ethics. I think it's 1.5, section 1.5, that talks about as nurses we need to care for ourselves as equal that we would care for our patients. So what I would like to ask you is right now, and take a minute to reflect this, do you take care of yourself the same way that you take care of your patients. Now, I talked at a national conference recently, a few weeks ago, and there was 300 people in the room, and I asked that question. I asked them to raise their hand. One person out of the 300 raised their hand and said, yes, I take care of myself. And I actually saw that person, and wow, she looked 10 years younger than when I saw her last, and she'd lost 15 pounds, and she had just great color, and it was incredible to see what happens when you take care of yourself. Big smile, happy, and she said it took her a long time, took her to the point of, you know, almost being physically ill to turn around and take care of herself. So we don't do that. So if you believe in the code of ethics and you believe that that's our professional kind of legal duty, I'd like to challenge you to start taking care of yourself, and start today, and start by looking at some things in your life that are important. And in the workplace, carry it over in the workplace. That's just not work and running at work and then going home and taking care of yourself. It's a balance. It's within the workplace. And if we acknowledge that we tend to be a little bit, they don't use the word codependent anymore, but a profession that wants to help everybody else before we help ourselves, then I think we need to acknowledge that a buddy system will work. And for me personally, you know, I'm not a person that likes to go out and exercise and do all that unless I'm with a buddy. And the research shows that women will exercise for emotional support with other people. That's their motivator. So I go with my neighbor and we walk around the hills here. And I will also go with friends and walk or hike, or I'll bike with my husband, or do something with my grandchild. But I'm not a person that, I'm going to go and jump on the treadmill. So I think we need to find within ourselves what motivates you. And if you can do several things at once, sit and visit or and hike and bike, that's great too. So men are different. There are some genders within this. Females are motivated by social support. Men tend to be motivated by competition. So if you're going to do anything within the workplace to keep yourself healthy, and I really challenge you to do that, because there's always one or two people that are really good at pulling the team together and saying, hey, what can we do with each other? Let's do the buddy system. Up in Great Falls, Montana now, they're looking at this model that is a buddy system model where you can actually do stretching and flexibility exercise at work, that you do head and neck exercises while you're at the computer looking at lab work, reviewing charts. When you're standing up, even talking to a patient, that you work on your core body movement, that you lift your foot up about on a 12-inch step stool or object so that you align your back better, and that you actually do pull your core body up, and that you're aware of your posture, especially your back. So that goes into stress, physical stress. I'm speaking of now not just the emotional stress of our job, but physically this repetitive motion that we have is very damaging. The last study I saw looked at really nursing and focused on nursing assistants too, that because of the repetitive motion, that it was the #2 profession in the United States that had most wear and tear and repetitive motion injury on your joints. Not something that you're going to say, oh, my aching back right now, but over time you are going to have shoulder joint problems. And some of these exercises that you can do in the workplace, and we will talk about that at another session, you actually do work on stretching your joints and breathing and slowing yourself down. And we're multitaskers, so that you know that you can work and breathe and talk to your patient at the same time and do some stretches and be aware of what you're doing. And it's just an awareness of that. So I'm going to challenge you to do that, and we will talk about that in a later presentation on how to do those office stretches. Another piece with stress is the stress on the bladder, the stress with dehydration in the work setting. Really important to drink fluids, to keep your fluids up. And I'm not talking about caffeine, and I'm not talking about carbonated sodas. So if you can really have some good nutrition and work on that, and I'm not going to preach to the choir, because I know that you guys know how to take care of yourself and how to eat well, but no lunch breaks where you can't even sit down for 20 minutes and nourish your body with good food away from the workplace. It's really important to do that. So I'd encourage you to use that buddy system again and have some breaks for each other, cover for each other. Let the person get away from your floor unit. So They can even go outside, even if you go outside in this environment for 5 minutes, walk outside, go down the stairs, walk outside, take a walk for 5 or 10 minutes, do nice slow breathing, meditate, say a mantra, all will be well, all will be well. We know people that repeat mantras are much more healthy and have stronger coping skills. So pick that special mantra that you have. That will lift you up and renew you. Then come back within the workplace. Doesn't even need to take 15 minutes, 30 minutes. And know that somebody's covering your patients for you and doing your job so that you know that your patients are safe. Get away from the place. You know, we've told students for years, and the research has shown that if you study for 4 hours straight, you study for 2 hours straight, and you're not thinking right, it's not going to be the same way. So the same with nursing. Get away. You will come back with that clarity, that sharp mind. That's really important. You can go, you can pray for people when you take a walk. You can pray for your patients, you can pray for your colleagues. Think positive thoughts towards them and for yourself. Really good, really healthy. Address that stress. Now, we're going to be going into another area of stress, which is within the team relationships. Whenever you get into a really busy situation, like at work, with high acuity, and last week I was kind of in a situation where the nurses were really short-staffed at where I work, and nobody could find anybody to help, not even any lift help, any moving help. And of course the managers were all having a big meeting up on the unit throughout the whole hospital, so there was about 10 managers there. And it's really, it's really easy to blame other people and have animosity when you're short-staffed, but it's so important to state your concerns clearly. And we will be talking about the EAR technique, E-A-R, when you do have concerns with people. E is empathy. A is assertiveness, assertive on what you're concerned with and what you need help with. And then R is respect. And the common thing is one of the nurses came in and was kind of cussing out somebody else and was so upset because nobody was there and patients were getting out of bed. You know how that is, and that we're in an intensive care unit. And what I go back to look at that situation is nurses didn't have lunch. They didn't have their potty breaks. Acuity was getting higher. They were short-staffed. You need to follow through instead of thinking and blaming and judging other people. Is follow through. Call the staffing office. Make sure that your concern has not just you told one busy person who forgot to tell, that you go through that chain of command and that you see, can we have more help up here? Oftentimes, even if it's a CNA to come in and help and take care of patients, sit with patients, we need to think creatively to get our needs met for our patients. So I really encourage you to follow through with that and try not to get frustrated when you're frustrated. Take a deep breath and go to the person and communicate what you need clearly. And use the word in the empathy. So the E starts for empathy. EAR stands for really listening and really looking at the situation. So in that situation, as I look back, I might have pulled my manager out of the meeting and said, excuse me, I know you're really busy, but I need to talk to you for a minute. And then just say, I value that you're at an important staff meeting or important management meeting, but we really need help. I don't have time to call everybody right now because I'm worried about patient safety. Could you please find extra staff for us? And could you please have somebody cover these patients because it's not safe right now. We don't have enough staff. And then follow it up with that respect, I know that you care a lot for patients. I know you care a lot for outcome. I know you want to have a good safety record here, and I really appreciate you looking into this now. So the assertiveness, I really love being assertive in that you say what you need, and you say that you don't have time to do it. That's the thing that, once you identify a concern, some managers will put it back to you and say, well, call this and do this. That you need to say, I am concerned for patient safety. I am doing this right now. I don't have time to do this. Will you please do this for me and get back to me on what you find? So follow up on that. And afterwards, I'd like for you all to do some role-playing. And for you all that are by yourself listening to this, if you would just write down a situation that you've had in the past and say, how could I have done that a little better? how could I have done that a little better? Instead of saying, oh, why didn't you call staffing, or why didn't you follow up on that? You don't know the whole situations. Yes, the person probably did share that they needed help in staffing, and maybe it wasn't communicated enough. Somebody came back and thought it was better, and or that you didn't call back, that you must not have needed some extra person. So we have to make our request really clear. Number them if you need. First of all, I need you to call staffing for me. I need you to follow up and get some extra help. And then you need to come back and tell me what your plan is for that. And you might even go on, I need somebody to come up here and cover for lunches immediately, because the nurses, this stress, you know, it builds. You get hypoglycemic, you get exhausted, you get dehydrated. Many a times nurses can get dizzy in the workplace. Not a good idea. Okay, you're not clearly thinking. So use that ear technique. I think it's great. I encourage you to use it in relationships with team members, with your personal relationships. It's really great, because in the study that we're going to move into next and talk about, the workplace study by Dr. Gardner, the main theme of that qualitative study is that nurses are striving to be heard and recognized, and they have a voice, but they don't feel like their voice is heard in the workplace. So for you nurses, you staff nurses, and for your managers that don't feel like you're heard from administration, it's really important for you to use that ear technique. Be empathetic about their role, because all of us are getting hit on so many different roles. And then to be assertive and say exactly what you need. If it's a manager, what do you need from administration? And don't blame anybody when you do that. Don't say, you know, I feel like you're not supporting me. Just do the request that you need, and then follow it up by, can you do that, and get a response from that, so that you feel like you have some help with that, and follow up with respect. So I recommend that you do that. So let's take out that one article that you all will have in your packet, the Striving to be Heard and Recognized. I think it's a really important national study. It worked specifically with dialysis nurses, but there's such a good cross-section across the United States that talks about current issues in the workplace. And I want you to feel that these are no different than what you're feeling. And I think that the good thing about qualitative research is that it fits in all different areas, and you can take these results and really look at this. So this study took the workplace environment magnet qualities and applied them in focus groups, asking nurses what their main concerns were and if they felt like these magnet characteristics were followed in the workplace. And as you turn to that, I'm looking at, I guess these aren't page numbers, but I'm going to look at the study results, and we're going to talk about the categories of the results. And as I talk about this, I'm going to read some quotes to participants. And so the number one thing that nurses thought were really important, and I know you guys can all relate to this, is maintaining competency. That all nurses want to be competent in the workplace, no matter what the environment is. And they don't want anything compromised on that. And this one nurse said, nurse work is different than other jobs. We have a moral responsibility to care for our patients and to do what is best. Our patients are very vulnerable, and it's our responsibility to take care of them. I love that, in that nurses, more than anything, want to be safe, and they want to carry out their role with competency. And that participants in this research study were really committed to that. And they felt like, in collaboration with the managers, that the nurses wanted to be involved in hiring practices, so that they were able to hire nurses that were also, that believed in the team approach and that could work well as a team. And I think that's really important, that nurses participate in that. And most across the United States, they are, and they do have a voice in that. The second primary category here was resolving inadequate staffing problems and resources. So it's not just staffing, but resources. Really important. They felt like they had to police other coworkers. That was very upsetting for them. They felt like there was a lack of nursing presence at the bedside because they were so busy doing managerial or leadership duties in addition to their own job. And they had a lack of backup staffing. So when acuity was high, when there was problems on the units related to let's talk about demise of a patient or unexpected issues, medical issues, that they didn't have enough backup staffing. These are the things nurses definitely have voices on for management. So I really recommend to any managers that are listening that the best person at solving these problems are the staff nurses. They have incredible ideas for that. So if you could meet with them to discuss these, it's great too, and we'll talk about some issues also here. Nurses want to round with doctors. They want to have time to work with the team. They want to collaborate. And in this model where their acuity is so high and staffing is not so great, they feel like they're putting out fires all the time, and that they go home not feeling good. They go home feeling hopeless. So really important. Another quote, nurses are leaving the workplace because they are overwhelmed. We leave here at night and we worry about what we didn't do for the patients. It is awful when you don't think you had time to do things your very best for the patient. I think she said it really well. Another one said, when you talk to the patient and ask, how are you doing today? You are really hoping that they just say fine, and that they aren't sick or don't have an immediate need. It makes you feel terrible that you don't have the time to spend with them. So lack of nursing presence, backup staffing is really, really important issues that I would like you guys to discuss as a group today. That would be great. The third category was strengthening organizational leadership. And in these focus groups, I thought it was really interesting. The nurses identified that most nurses that went into leadership positions and management positions were really good staff nurses, and that's why they were selected for these positions. Leadership-wise, the great staff nurses don't necessarily make the best leaders. And if they would be transferred into a position like that, there's some conflict because there's some role changes from staff nurse to management, and there's education that needs to be done. So across the nation, the voice was that our greatest nurses that are becoming supervisors in management, they need education and training specifically on skills related to leadership. And one of them that they pointed out was they need training on how to confront and discipline people that need discipline. They need training on hiring practices and termination practices. So the follow-through that these nurses across the nation thought was really difficult for managers was to actually discipline and follow through with that. But maybe even look at it in a way with the team that, is this necessarily all the manager's responsibility? But if we were really on the top of our game, and if we were really using that ear technique to confront each other, that maybe we wouldn't put these big burdens on our managers also, that it's their job to discipline and their job to follow through. Maybe we could do our job in that too by saying, you know, I've talked to this person 3 times related to this one behavior and it's not improving. And maybe when you do talk to somebody using the ear technique and the level of a staff nurse, that you can say, you know, I've talked to you about this several times and it's not improving. Maybe it's time for somebody else to help you with this, and maybe the manager, you know, can help with this. So I really recommend using that in honest, open, and following it up with respect, because I believe in you and I think you can be the best staff nurse or manager. That's why I think that you need extra help in this, because you do have that potential. So always follow it up with that respect for human dignity. Which brings me back to the ANA Code of Ethics. You know, I hadn't read the ANA Code of Ethics probably in 20 years, and so I read it this year for ethics class that I was taking at Gonzaga, and I was shocked because they had, I call it this new, but it was probably written 10 years ago, section that says, it's my responsibility to treat my colleagues with total respect and human dignity, even though they are doing things that I don't believe in or that I totally disagree upon, that I have an ethical duty and responsibility for conflict resolution. So it's not just tolerating people's bad behavior, it's not just tolerated repeated errors that people make or things that are high risk. I have an ethical duty to follow up and have conflict resolution. And often if I can't do that, then I need to bring in a third person. I need to bring in somebody else in the team that can help do that. So I'm really recommending that you work together on that, and that you really take that to heart. You have responsibility as a team member to treat you with human respect. So that means that maybe there's somebody that's different. I appreciate diversity. Some people don't appreciate diversity. I recently heard this keynote speaker that was incredible that said, instead of getting rid of these people that we don't like and terminating them, we have the ethical responsibility to embrace diversity, to embrace everybody's strengths and weaknesses. If they were able to pass that first interview, that you have an employment interview and had all the qualifications to hire them, then let's work together as a team and embrace people's differences and even celebrate them. But bring them to the light. Talk to people about that. If it's something that's impeding other people's work issues, let's talk about it. And use that ear technique and show them you respect them. I had somebody who came up to me and said, Joni, I just love the way you want to help everybody and that you want to get us caught up with our time, but I really want to take off my own orders. I don't like other people taking off my own orders. I feel safer when I take off my own orders. So even though I respect you doing that, will you not do that anymore? Boy, I love the way this person said that to me, because you know what? Number one, I hate taking off orders, but I feel like, I want the patient to get their meds right away, and I want to take off the orders for them. But yes, you know what? Maybe there's something else I can do for you if that's what you value, is taking off orders. Maybe I can get your patient admitted for you, or maybe I can take vital signs. Maybe I can do the history. Tell me what else, would work for you. So I think it's really, really important. There was this most incredible study that's going to be published coming up that I thought was really interesting by Shoshana Seed, and it will be in the Hospice and Palliative Care Journal coming up this summer. And I wrote this article with her. It was from a research study, but one of her themes was the safety net for hospice nurses for when they totally are off balance, they're totally stressed out, they can't handle the stress anymore of death and dying or of other things, and they don't have a balance in their life within health and wellness. And they've maybe stepped over a few boundaries personally with patients, gotten too involved in the death. The theme was falling back on the team, and I absolutely love it. And that's what these nurses said, falling back on the team. So we use that same quote. Wouldn't it be incredible to have a team that you could fall back on as your safety net, as your place for renewal, as your place to just to talk and to share your burdens, that you trusted your team so much that they were your safety net? And that's what in this study, what nurses did. It was done in different cities, so it had a different blend of nurses, but falling back on the team. So there are certain teams that really do fall back. They will stop what they're doing if somebody is having a crisis or getting stressed out, and they can tell intuitively because the person's different or their body language is different, and they step right in and they say, what can I do to help you so that you can have a break? They will take over the person's patients. They will shift things around. They will let the person have a break. They'll let the person go home if they need to go home. They will let them have a few days off for their health and wellness. I love that concept, and they all do it for each other equally. What an incredible concept, falling back on the team. We've gone on cycles with the thing related to the team. This collaborative team is such an important process within precepting, within growing our new nurses. I love that idea of growing new nurses, that we are there for their growth and development. You've heard forever there's been books published by Dr. Judith Briles, From Sabotage to Support, that we get in a sabotage model, we don't mean to do it when we are unhealthy ourselves, unhealthy because we haven't had lunch breaks, because we're working too hard, because we are breaking our own ethical model of not even taking care of ourselves, and we can't even take care of patients within that. So it's really important to go back to ground zero, to meet as a whole team, with the whole healthcare team, with your managers, with your administrators. What can we do to have a team that we can fall back on, that's there for a safety net when we are overwhelmed and burdened? You know, this patient is deteriorated. We need somebody else to step in and take